Question 1. Performance analysis shows that a patient with a long-standing history of plantar fasciitis and associated biomechanical inefficiencies is experiencing recurring pain and functional limitations despite previous orthotic interventions. Which of the following strategies best represents a comprehensive and effective approach to managing this chronic condition? Option A. Recommending a short-term course of anti-inflammatory medication and advising the patient to rest and avoid activities that aggravate their symptoms. Option B. Suggesting a referral to a different healthcare professional for a second opinion without providing any immediate pedorthic management recommendations. Option C. Implementing a revised orthotic prescription with advanced cushioning and shock absorption features, coupled with a detailed home exercise program focusing on stretching and strengthening, and scheduling regular follow-up appointments for ongoing assessment and adjustments. Option D. Modifying the existing orthotics with minor adjustments to arch support and recommending over-the-counter arch inserts for daily wear. Correct answer is C. Implementing a revised orthotic prescription with advanced cushioning and shock absorption features, coupled with a detailed home exercise program focusing on stretching and strengthening, and scheduling regular follow-up appointments for ongoing assessment and adjustments. Explanation. This scenario presents a professional challenge due to the chronic nature of the patient's foot condition, requiring a long-term, adaptive management strategy rather than a one-time fix. The pedorthist must balance immediate symptom relief with strategies that promote sustained foot health and functional independence, all while adhering to the scope of practice and ethical obligations outlined by the Canadian Certified Pedorthist C. regulatory framework. Careful judgment is required to select interventions that are evidence-based, patient-centered, and aligned with professional standards. Correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted strategy that addresses the underlying biomechanical issues, incorporates patient education for self-management, and establishes a clear plan for ongoing monitoring and adjustment. This aligns with the CertMedbry mandate to provide safe, effective, and ethical pedorthic care. Specifically, it reflects the professional obligation to conduct thorough assessments, develop individualized treatment plans, and empower patients in their care, thereby promoting optimal outcomes and preventing exacerbations of chronic conditions. This approach also implicitly supports the ethical principle of beneficence by aiming for the patient's long-term well-being. An incorrect approach that focuses solely on symptomatic relief without addressing the root cause fails to meet the professional standard of care. It may lead to temporary improvement, but does not prevent the progression of the chronic condition, potentially violating the ethical duty to provide competent and comprehensive care. Another incorrect approach that neglects patient education and self-management strategies undermines patient autonomy and their ability to actively participate in their care, which is a cornerstone of modern healthcare practice and professional responsibility. Furthermore, an approach that fails to establish a follow-up plan or monitor progress is a dereliction of duty, as chronic conditions necessitate ongoing assessment and modification of interventions to remain effective, potentially leading to patient harm and contravening the regulatory expectation of diligent practice. Professionals should employ a decision-making framework that begins with a thorough patient assessment, including a detailed history, physical examination, and biomechanical analysis. This is followed by the collaborative development of a treatment plan that considers the patient's goals, lifestyle, and the evidence base for various interventions. Regular reassessment and adjustment of the plan based on patient response and evolving needs are crucial. Throughout this process, clear communication, patient education, and adherence to the CertMedbry Code of Ethics and Standards of Practice are paramount. Question 2. Market research demonstrates a growing demand for pedorthic services addressing complex foot pain. A patient presents with intermittent burning, tingling, and numbness in their feet, particularly after prolonged standing, with some associated pallor and coolness in the extremities during these episodes. Considering the nerve supply and vascularization of the foot, which of the following diagnostic and management approaches best aligns with the scope of practice for a Canadian Certified Pedorthist CertMedbry? Option A. Prescribe a course of anti-inflammatory medication and recommend a referral to a vascular surgeon without performing an initial pedorthic assessment of the foot's biomechanics. Option B. Focus solely on assessing the patient's gait and foot posture and recommend a general exercise program to improve circulation without further diagnostic investigation of nerve or vascular function. Option C. Immediately fabricate custom orthotics designed to improve foot mechanics, assuming the symptoms are primarily due to pronation or supination, and advise the patient to rest and elevate their feet. Option D. Conduct a thorough neurological assessment including sensory and motor testing, palpate peripheral pulses, assess capillary refill, and evaluate skin temperature and color to differentiate between potential nerve compression and vascular insufficiency, and then formulate an orthotic plan or refer as indicated. The correct answer is D. Conduct a thorough neurological assessment including sensory and motor testing, palpate peripheral pulses, assess capillary refill, and evaluate skin temperature and color to differentiate between potential nerve compression and vascular insufficiency, and then formulate an orthotic plan or refer as indicated. Explanation. Scenario analysis. This scenario presents a common challenge for a Canadian certified pedorthist, CPED-C, where a patient presents with symptoms that could be attributed to either nerve compression or vascular insufficiency in the foot. Differentiating between these two conditions is critical because the treatment approaches are fundamentally different and can have significant implications for patient outcomes. Misdiagnosis could lead to delayed or inappropriate treatment, potentially exacerbating the underlying condition or causing new complications. The CPED-C's role requires a thorough understanding of the foot's anatomy, including its nerve supply and vascularization, to accurately assess the patient's presentation and formulate an effective management plan within their scope of practice. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes understanding the specific neurological and vascular pathways involved. This includes a detailed patient history focusing on the onset, character, and aggravating/alleviating factors of the symptoms, a comprehensive physical examination that tests sensory and motor nerve function, e.g., light touch, pinprick vibration, proprioception, muscle strength, and vascular assessment, e.g., palpation of pulses, capillary refill time, skin temperature, color. This methodical approach aligns with the CPED-C scope of practice, which emphasizes biomechanical assessment and the provision of orthotic and prosthetic devices. By gathering this detailed information, the CPED-C can form a differential diagnosis and determine if the symptoms are within their purview to manage with orthotic intervention or if referral to another healthcare professional is necessary. This adheres to the ethical principle of practicing within one's competence and ensuring patient safety. Incorrect approach is analysis. One incorrect approach would be to immediately assume the symptoms are solely due to biomechanical issues and proceed with fabricating a standard orthotic device without a thorough neurological and vascular assessment. This fails to acknowledge the potential for underlying systemic or neurological conditions that orthotics alone cannot address, potentially delaying diagnosis and treatment of a more serious issue. This could be considered a failure to meet the standard of care expected of a CPED-C and could violate ethical guidelines regarding patient assessment. Another incorrect approach would be to focus exclusively on vascular assessment and recommend interventions that are outside the scope of a CPED-C, such as prescribing medication or recommending surgical vascular procedures. While vascular compromise is a possibility, the CPED-C's primary expertise lies in biomechanics and orthotic intervention. Overstepping this scope of practice is a regulatory and ethical failure. A third incorrect approach would be to dismiss the patient's symptoms as non-significant or psychosomatic without a proper diagnostic workup. This demonstrates a lack of due diligence and a failure to adhere to the professional obligation to thoroughly investigate patient complaints, potentially leading to patient harm and a breach of professional conduct. Professional reasoning. When faced with ambiguous symptoms like those described, a CPED-C should employ a structured decision-making process. This begins with a comprehensive patient history and a targeted physical examination, focusing on differentiating between neurological, vascular, and biomechanical etiologies. The CPED-C must then critically evaluate the findings in relation to their scope of practice. If the assessment strongly suggests a condition that can be effectively managed with orthotic intervention, the CPED-C proceeds with appropriate treatment. However, if the findings indicate a condition that falls outside their expertise or requires medical management, e.g., significant vascular disease, neurological deficits requiring medical or surgical intervention, the CPED-C must promptly and appropriately refer the patient to the relevant healthcare professional, such as a physician, vascular specialist, or neurologist, while continuing to collaborate on the patient's care as appropriate. This ensures patient safety and optimal outcomes. Question 3. Analysis of patient presenting with persistent, localized heel pain that has worsened over several weeks, accompanied by noticeable swelling and warmth in the affected area, and a palpable bony prominence. The Pedorthist has ruled out common biomechanical causes for heel pain through gait analysis and palpation of plantar fascia insertion. What is the most appropriate course of action for the Canadian certified Pedorthist? C. In this situation? Option A. Proceed with fabricating custom orthotics designed to offload the heel, assuming the bony prominence is a calcaneal spur and the pain is solely due to plantar fasciitis. Option B. Refer the patient to a physician for further medical evaluation and diagnosis, as the signs and symptoms suggest a potential underlying pathology beyond the scope of pedorthic practice. Option C. Recommend over-the-counter anti-inflammatory medication and advise the patient to rest, while continuing with standard orthotic adjustments for plantar fasciitis. Option D. Advise the patient that the symptoms are likely due to overuse and will resolve with time, without further investigation or referral. Correct answer is B. Refer the patient to a physician for further medical evaluation and diagnosis, as the signs and symptoms suggest a potential underlying pathology beyond the scope of pedorthic practice. Explanation. This scenario presents a professional challenge due to the need to differentiate between a common, benign condition and a more serious pathology that requires specific medical intervention. The pedorthist must rely on their clinical assessment skills and understanding of lower limb biomechanics to identify potential red flags. The challenge lies in not overstepping the scope of practice while ensuring the patient receives appropriate care. The correct approach represents best professional practice because it prioritizes patient safety and appropriate referral. By recognizing the limitations of a pedorthist's role and initiating a referral to a physician when a concerning pathology is suspected, the pedorthist adheres to the principles of responsible practice as outlined by the Canadian Certified Pedorthist C. regulatory framework. This framework emphasizes the importance of recognizing conditions beyond the scope of pedorthic practice and facilitating timely access to medical diagnosis and treatment. An incorrect approach that involves attempting to manage the suspected pathology with orthotic devices alone without medical consultation would be a significant regulatory and ethical failure. This would constitute practicing outside the defined scope of pedorthics, potentially delaying necessary medical treatment and causing harm to the patient. Furthermore, failing to document the assessment findings and the rationale for referral would be a breach of professional record-keeping standards, hindering continuity of care and accountability. Another incorrect approach would be to dismiss the patient's symptoms without a thorough assessment, which would be a failure to provide competent care and could lead to a misdiagnosis. Professionals should employ a systematic decision-making process that begins with a comprehensive patient history and physical examination. This includes assessing gait, range of motion, palpation for tenderness or swelling, and observing skin integrity. Based on these findings, the pedorthist should compare the presentation against known common foot and lower limb pathologies and consider the possibility of more serious underlying conditions. If there are signs or symptoms suggestive of a condition requiring medical diagnosis or treatment, e.g., significant inflammation, neurological deficits, suspected fractures, or systemic disease manifestations, the professional obligation is to refer the patient to a qualified medical practitioner for further evaluation and management. Documentation of the entire assessment process, including the rationale for any referral, is crucial. Question 4. Benchmark analysis indicates that a patient presents for a consultation stating they have flat feet and require orthotics to correct it based on information they found online. The patient reports mild discomfort during prolonged standing. As a Canadian certified pedorthist Ped-C, what is the most appropriate initial approach to address this patient's concerns and needs? Option A. Immediately proceed with fabricating custom orthotics based on the patient's self-diagnosis of flat feet, as their stated need is clear. Option B. Conduct a thorough biomechanical assessment to objectively evaluate the patient's foot structure, function, and the presence and severity of any deformities, and discuss findings and treatment options with the patient. Option C. Advise the patient that their self-diagnosis is likely incorrect and that no intervention is necessary given the mild discomfort. Option D. Refer the patient to a physician for a definitive diagnosis of their foot condition before proceeding with any pedorthic assessment. The correct answer is B. Conduct a thorough biomechanical assessment to objectively evaluate the patient's foot structure, function, and the presence and severity of any deformities, and discuss findings and treatment options with the patient. Explanation. This scenario presents a common implementation challenge for a pedorthist, managing patient expectations and ensuring appropriate care when a patient presents with a self-diagnosed condition that may not align with their objective clinical findings. The challenge lies in balancing patient autonomy and their perceived needs with the pedorthist's professional judgment and the ethical obligation to provide evidence-based care. The regulatory framework for Canadian certified pedorthists, PED-C, emphasizes patient-centered care, professional competence, and adherence to ethical standards, which include accurate assessment and appropriate intervention. The correct approach represents best professional practice because it prioritizes a thorough, objective clinical assessment to determine the underlying cause of the patient's symptoms. This aligns with the PED-C Code of Ethics, which mandates that pedorthists act in the best interest of the patient, utilizing their knowledge and skills to provide appropriate care. By conducting a comprehensive biomechanical assessment, the pedorthist can accurately identify any foot deformities, their severity, and their functional impact, thereby developing a treatment plan that is evidence-based and tailored to the patient's specific needs, rather than solely on their subjective report. This also upholds the principle of informed consent, as the patient will be presented with objective findings and a rationale for the proposed interventions. An incorrect approach that relies solely on the patient's self-diagnosis without independent clinical verification fails to meet the professional standard of care. This could lead to inappropriate or unnecessary interventions, potentially causing harm or delaying effective treatment. Ethically, this would be a failure to exercise professional judgment and competence, potentially violating the PED-C Code of Ethics regarding providing services within one's scope of practice and ensuring the quality of care. Another incorrect approach, such as dismissing the patient's concerns outright without a thorough assessment, demonstrates a lack of patient-centered care and disrespect for the patient's experience, which is also contrary to ethical practice. The professional decision-making process for similar situations involves a systematic approach. 1. Active listening and information gathering. Understand the patient's chief complaint, their perceived problem, and their expectations. 2. Comprehensive clinical assessment. Conduct a thorough biomechanical evaluation, including gait analysis, range of motion, palpation, and observation of foot posture. 3. Differential diagnosis. Consider various potential causes for the patient's symptoms, including but not limited to the self-diagnosed condition. 4. Evidence-based treatment planning. Develop a treatment plan based on objective findings and current best practices, explaining the rationale to the patient. 5. Patient education and shared decision-making. Clearly communicate the assessment findings, treatment options, and expected outcomes, involving the patient in the decision-making process. 6. Documentation. Meticulously document all findings, assessments, discussions, and treatment plans. Question 5. Quality control measures reveal a discrepancy between a patient's self-reported history of activity levels and pain triggers, as documented in their chart, and the objective findings from the pedorthist's clinical examination during a follow-up appointment for custom orthotics. The patient's stated history suggests a sedentary lifestyle with minimal exacerbation of symptoms during daily activities, yet the clinical examination reveals significant signs of overuse and inflammation consistent with high-impact activities. The pedorthist is unsure how to proceed with the orthotic adjustment and future recommendations. Option A. Recommend a period of rest and activity modification based on the clinical findings, without directly addressing the discrepancy in the patient's reported history. Option B. Proceed with the orthotic adjustment based solely on the documented patient history, assuming the clinical findings are transient or unrelated to the primary issue. Option C. Unilaterally update the patient's chart to align the documented history with the clinical examination findings, without consulting the patient. Option D. Gently discuss the observed clinical findings with the patient, explaining the discrepancy and seeking clarification to ensure the orthotic device and future recommendations accurately address their needs and lifestyle. The correct answer is D. Gently discuss the observed clinical findings with the patient, explaining the discrepancy and seeking clarification to ensure the orthotic device and future recommendations accurately address their needs and lifestyle. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to maintain patient confidentiality, while also adhering to professional standards for accurate record-keeping and patient care. The pedorthist is faced with a discrepancy between the documented patient history and the observed clinical findings, which could impact the effectiveness and safety of the prescribed orthotic device. Careful judgment is required to determine the most appropriate course of action that respects the patient's autonomy and privacy, upholds professional integrity, and ensures optimal patient outcomes. The correct approach represents best professional practice because it prioritizes open communication and patient collaboration. By respectfully addressing the discrepancy with the patient, the pedorthist demonstrates a commitment to accurate assessment and personalized care. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as an accurate understanding of the patient's history and current condition is crucial for effective treatment. Furthermore, it upholds the principle of autonomy by involving the patient in the diagnostic and treatment planning process. This approach also supports the regulatory framework by ensuring that patient records are accurate and reflect the most current and relevant information, which is essential for continuity of care and professional accountability. An incorrect approach that involves unilaterally altering the patient's documented history without their explicit consent or further investigation would be a significant regulatory and ethical failure. This breaches the principle of patient autonomy and informed consent, as the patient has a right to understand and agree to the information recorded about their health. It also compromises the integrity of patient records, potentially leading to misdiagnosis or inappropriate treatment if the altered information is not truly reflective of the patient's situation. Another incorrect approach, such as ignoring the discrepancy and proceeding with the original plan, fails to uphold the duty of care. This could result in an ineffective or even harmful orthotic device, violating the principles of beneficence and non-maleficence. It also demonstrates a lack of due diligence in the clinical examination process, which is a core professional responsibility. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the discrepancy. Clearly recognize the conflict between the patient's reported history and clinical findings. 2. Prioritize patient well-being and safety. Consider how the discrepancy might affect the patient's health and the effectiveness of the intervention. 3. Seek clarification through open communication. Engage the patient in a non-confrontational dialogue to understand the reasons for the discrepancy. 4. Document all findings and discussions. Maintain accurate and thorough records of the patient's history, clinical examination, and any conversations held. 5. Reevaluate the treatment plan. Based on the clarified information, adjust the orthotic prescription or treatment strategy as necessary. 6. Consult with colleagues or supervisors if uncertainty persists. Seek guidance when faced with complex ethical or clinical challenges. Question 6. Research into the management of foot pain and functional limitations in a 65-year-old patient diagnosed with moderate osteoarthritis affecting the first metatarsophalangeal joint and the subtalar joint reveals significant compensatory pronation and reduced ankle dorsiflexion. Considering the Canadian Certified Pedorthist C. Ped C. Scope of practice and ethical guidelines, which of the following approaches best addresses the patient's needs? Option A. Recommend a standard over-the-counter arch support to provide general arch support and alleviate immediate discomfort. Option B. Prescribe custom orthotics with a rigid posting to control pronation and a heel wedge to improve dorsiflexion, coupled with patient education on joint protection strategies and appropriate footwear. Option C. Advise the patient to purchase wider, more cushioned shoes without a specific biomechanical assessment or orthotic intervention. Option D. Refer the patient directly to a rheumatologist for medication management without any pedorthic intervention. The correct answer is B. Prescribe custom orthotics with a rigid posting to control pronation and a heel wedge to improve dorsiflexion, coupled with patient education on joint protection strategies and appropriate footwear. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the pedorthist to balance the patient's immediate comfort and functional needs with the long-term management of a chronic, progressive condition. Arthritis, particularly osteoarthritis, can significantly alter foot biomechanics, leading to pain, reduced mobility, and potential secondary complications. The pedorthist must possess a thorough understanding of arthritic processes, their varied presentations in the foot and ankle, and the principles of biomechanical management. This involves not only assessing the current state of the patient's feet, but also anticipating how the condition might evolve and how interventions might impact that progression. Accurate assessment, appropriate device prescription, and effective patient education are paramount to achieving optimal outcomes and preventing further deterioration. Correct approach analysis. The correct approach involves a comprehensive biomechanical assessment that specifically identifies the impact of arthritis on the patient's foot structure and function. This includes evaluating joint range of motion, muscle strength, gait patterns, and the presence of deformities or inflammatory changes. Based on this detailed assessment, the pedorthist would then develop a treatment plan that may include custom or modified prefabricated orthotics designed to offload pressure from affected joints, support weakened structures, and improve alignment. This approach aligns with the Canadian Certified Pedorthist C. scope of practice, which emphasizes the assessment, treatment, and management of foot and lower limb conditions through the design, manufacture, and fitting of orthotic devices. It prioritizes evidence-based practice and patient-centered care, ensuring that interventions are tailored to the individual's specific arthritic condition and functional goals, thereby promoting comfort, mobility, and preventing secondary issues. Incorrect approaches analysis. One incorrect approach would be to provide a generic, off-the-shelf orthotic without a thorough biomechanical assessment. This fails to address the specific biomechanical compensations and pressures caused by the patient's arthritis, potentially exacerbating pain or leading to new problems. Ethically, this is a failure to provide competent care and to act in the patient's best interest, as mandated by professional standards. It also falls short of the C requirement for individualized assessment and treatment planning. Another incorrect approach would be to focus solely on pain relief without considering the underlying biomechanical issues contributing to the pain. While pain management is important, neglecting the biomechanical factors that perpetuate the arthritic process can lead to a cycle of temporary relief followed by recurrence of symptoms. This is a failure to provide comprehensive care and to address the root cause of the patient's functional limitations, which is contrary to the principles of evidence-based pedorthic practice. A third incorrect approach would be to recommend surgical intervention without a thorough pedorthic assessment and conservative management plan. While surgery may be indicated in some severe cases, it is typically considered after conservative measures have been exhausted. A pedorthist's role is to provide conservative, non-surgical interventions. Recommending surgery prematurely or without exploring all appropriate pedorthic solutions would exceed the scope of practice and could be detrimental to the patient. Professional reasoning. Professionals should approach such cases by first conducting a thorough and individualized biomechanical assessment. This assessment should be guided by the patient's reported symptoms, medical history, including the type and severity of arthritis, and objective findings. The pedorthist should then consider the principles of biomechanics and the pathophysiology of arthritis to determine the most appropriate orthotic intervention. This involves understanding how specific joints are affected and what biomechanical forces need to be managed. Patient education is a crucial component, empowering the patient to understand their condition and the rationale behind the prescribed treatment. Regular follow-up is essential to monitor the effectiveness of the intervention and make necessary adjustments as the condition evolves. This systematic approach ensures that care is evidence-based, patient-centered, and within the scope of practice for a Canadian certified pedorthist. Question 7. The performance metrics show a consistent pattern of reduced foot clearance during the swing phase of gait in a patient, leading to toe drag. Clinical observation suggests a potential weakness or impaired function of the muscles responsible for lifting the forefoot. Considering the muscles of the lower limb and their roles in gait, which of the following pedorthic approaches is most appropriate to address this specific functional deficit? Option A. Prescribe a comprehensive exercise regimen focusing on quadriceps and hamstring strengthening. Option B. Recommend a strengthening program for the gastrocnemius and soleus muscles to improve push-off. Option C. Refer the patient for an immediate surgical consultation to address potential nerve impingement. Option D. Design and fit an ankle-foot orthosis with a dorsiflexion assist mechanism to support the tibialis anterior's function. correct answer is D. Design and fit an ankle-foot orthosis with a dorsiflexion assist mechanism to support the tibialis anterior's function. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pedorthist to integrate clinical assessment findings with an understanding of lower limb biomechanics and muscle function, all within the scope of practice defined by the Canadian Certified Pedorthist (PED-C) regulatory framework. The challenge lies in accurately identifying the primary muscle groups involved in a specific gait deviation, and then determining the most appropriate pedorthic intervention based on this understanding, without overstepping into areas reserved for other healthcare professionals. The pedorthist must rely on their specialized knowledge of foot and ankle anatomy and biomechanics to make informed decisions about orthotic design and prescription. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the observed gait deviation by identifying the implicated muscle groups and proposing a pedorthic intervention that aims to support or facilitate their function. This aligns with the PED-C scope of practice, which includes the assessment, measurement, design, manufacture, and fitting of orthotics to address biomechanical issues of the lower limb. By focusing on the tibialis anterior's role in dorsiflexion and foot clearance, and suggesting an intervention to assist this action, the pedorthist is acting within their professional mandate to improve gait and function. This approach is evidence-informed and patient-centered, aiming to resolve the functional deficit. Incorrect approach is analysis, an approach that focuses solely on the gastrocnemius and soleus without considering the opposing muscle group, tibialis anterior, for a foot drop presentation is incomplete and potentially ineffective. While these plantar flexors are crucial for propulsion, their imbalance or weakness is not the primary cause of foot drop. Recommending interventions that primarily target these muscles for foot drop would be a failure to address the root biomechanical issue and could lead to suboptimal patient outcomes, potentially violating the ethical obligation to provide competent care. An approach that suggests a surgical consultation without a clear indication of a structural or pathological issue requiring surgical intervention would be an overreach of the pedorthist's scope of practice. Pedorthists are not physicians and should not be making recommendations for surgical procedures. This would be a significant regulatory and ethical failure, as it encroaches upon the domain of medical practitioners and could lead to unnecessary patient anxiety and cost. An approach that focuses on strengthening exercises for the quadriceps and hamstrings, while important for overall lower limb function, does not directly address the specific biomechanical issue of foot drop caused by impaired dorsiflexion. While a pedorthist may provide general advice on exercise, their primary role in this context is to address the biomechanical deficit through orthotic intervention. Recommending a comprehensive exercise program without a clear referral from a physiotherapist or physician could be considered practicing outside the defined scope of a pedorthist, especially if it implies a therapeutic role beyond orthotic prescription. Professional reasoning. Professionals should approach such situations by first conducting a thorough biomechanical assessment to identify the specific gait deviation and its underlying causes. This involves observing the patient's gait, palpating muscles, assessing range of motion, and understanding the kinetic chain. Based on these findings, the pedorthist should then determine if the issue falls within their scope of practice, which is primarily orthotic intervention. If the issue requires medical diagnosis, surgical intervention, or extensive physiotherapy, the pedorthist must recognize these limitations and refer the patient to the appropriate healthcare professional. The decision-making process should always prioritize patient safety, evidence-based practice, and adherence to the regulatory framework of the Canadian Certified Pedorthist PED-C. Question 8. Governance review demonstrates that a Canadian Certified Pedorthist PED-C is utilizing advanced biomechanical assessment tools, including pressure mapping and motion analysis in their practice. Which of the following approaches best reflects the regulatory framework and professional guidelines for the application of these tools? Option A. The pedorthist interprets the data from these tools in conjunction with a comprehensive patient history, physical examination, and functional assessment to inform the design and modification of footwear and foot orthoses. Option B. The pedorthist uses the biomechanical assessment data to justify the prescription of off-the-shelf footwear without a thorough evaluation of the patient's specific needs and biomechanical profile. Option C. The pedorthist relies primarily on the quantitative data output from pressure mapping and motion analysis to diagnose specific medical conditions of the foot and lower limb. Option D. The Pedorthist presents the biomechanical assessment data as absolute and unchanging indicators of a patient's gait, without considering individual variability or the influence of external factors. The correct answer is A. The Pedorthist interprets the data from these tools in conjunction with a comprehensive patient history, physical examination, and functional assessment to inform the design and modification of footwear and foot orthoses. Explanation. Scenario analysis. This scenario presents a professional challenge in the application of advanced biomechanical assessment tools within the scope of practice for a Canadian certified Pedorthist C. PED-C. The core difficulty lies in ensuring that the interpretation and utilization of data from these tools, such as pressure mapping and motion analysis, align strictly with the established standards of practice and regulatory guidelines set forth by the Pedorthic Association of Canada, PAC, and relevant provincial regulatory bodies. Misinterpreting or overextending the application of such data can lead to inappropriate clinical recommendations, potentially impacting patient outcomes and exposing the Pedorthist to professional liability. The challenge is to integrate sophisticated technology with fundamental Pedorthic principles and evidence-based practice, all while adhering to the governing framework. Correct approach analysis. The correct approach emphasizes the integration of biomechanical assessment data into a comprehensive Pedorthic assessment, ensuring that the findings from pressure mapping and motion analysis are used to inform, rather than dictate, the treatment plan. This aligns with the Pedorthic Association of Canada's PAC standards of practice, which mandate a thorough patient assessment that includes history, physical examination, and functional evaluation. The use of advanced tools is encouraged when they enhance the understanding of a patient's biomechanics and contribute to evidence-based decision-making. The correct approach ensures that the Pedorthist maintains clinical judgment, considering the technology's output within the broader context of the patient's condition, functional goals, and the limitations of the technology itself. This upholds the ethical obligation to provide competent and appropriate care, as outlined in the PAC Code of Ethics, by ensuring that interventions are justified by the overall assessment findings. Incorrect approaches analysis. One incorrect approach involves relying solely on the raw data output from biomechanical assessment tools without a thorough clinical correlation. This fails to meet the regulatory requirement for a comprehensive assessment, as it bypasses essential components like patient history and physical examination. Ethically, it risks providing recommendations based on incomplete information, potentially leading to ineffective or even harmful interventions. Another incorrect approach is to use these tools to diagnose medical conditions beyond the scope of practice for a Pedorthist. The regulatory framework for Pedorthists clearly defines their scope, which focuses on the assessment, design, manufacture, and modification of footwear and foot orthoses to address biomechanical issues. Using advanced tools for diagnostic purposes outside this scope is a direct violation of regulatory boundaries and ethical practice. A third incorrect approach is to present the data from these tools as definitive proof of a specific pathology without considering the dynamic nature of gait and the potential for variability in measurement. This oversimplification can lead to miscommunication with patients and other healthcare professionals, undermining the Pedorthist's credibility and potentially leading to inappropriate treatment pathways. Professional reasoning. Professionals should approach the use of biomechanical assessment tools by first understanding their purpose within the Pedorthic scope of practice. To enhance the understanding of foot and lower limb function, decision-making process should involve 1. Conducting a complete patient history and physical examination. 2. Selecting appropriate biomechanical assessment tools based on the patient's presentation and clinical questions. 3. Critically analyzing the data generated by these tools, correlating it with clinical findings. 4. Integrating all assessment data to formulate a diagnosis of Pedorthic relevance and develop an individualized treatment plan. 5. Communicating findings and treatment rationale clearly to the patient and other healthcare providers. This systematic approach ensures that technology serves as a valuable adjunct to clinical expertise, rather than a replacement for it, thereby upholding professional standards and patient welfare. Question 9. Which approach would be most appropriate for a Canadian certified Pedorthist to take when selecting materials for fabricating custom orthotics, considering the patient's history of skin sensitivities and their active lifestyle? Option A. Prioritize the use of the least expensive materials available to ensure cost-effectiveness for the patient, regardless of their specific properties or potential for sensitivities. Option B. Conduct a thorough risk assessment of all proposed materials, considering their properties, potential for adverse reactions, durability, and suitability for the patient's specific biomechanical needs and activity level, followed by informed patient consultation. Option C. Select materials based on personal familiarity and ease of fabrication, without extensively investigating their suitability for the patient's unique skin sensitivities or activity demands. Option D. Proceed with the fabrication using standard materials, assuming that any skin sensitivities will be managed post-orthotic delivery through topical treatments. Correct answer is B. Conduct a thorough risk assessment of all proposed materials, considering their properties, potential for adverse reactions, durability, and suitability for the patient's specific biomechanical needs and activity level, followed by informed patient consultation. Explanation. Scenario analysis. This scenario presents a common challenge in pedorthic practice, balancing patient needs and preferences with the inherent properties and limitations of orthotic materials. The pedorthist must consider not only the biomechanical requirements of the orthotic, but also the patient's lifestyle, potential allergies, and the long-term durability and safety of the chosen materials. Failure to adequately assess these factors can lead to suboptimal outcomes, patient dissatisfaction, and potential harm. The professional challenge lies in synthesizing clinical assessment, material science knowledge, and patient-centered care within the regulatory framework governing pedorthic practice in Canada. Correct approach analysis. The correct approach involves a comprehensive risk assessment that prioritizes patient safety and clinical efficacy. This means thoroughly evaluating the patient's specific condition, activity level, and any known sensitivities or allergies to materials. It requires consulting the manufacturer's specifications and safety data sheets for the proposed materials to understand their properties, potential breakdown products, and suitability for the intended use. Furthermore, it necessitates open communication with the patient regarding the rationale for material selection, potential risks, and expected outcomes. This aligns with the CertMedbry Code of Ethics and Practice Standards, which mandate providing competent care, acting in the best interest of the patient, and maintaining professional knowledge regarding materials and their applications. The regulatory framework implicitly requires pedorthists to make informed decisions based on evidence and patient-specific factors, ensuring that the chosen materials are safe, effective, and appropriate for the individual's needs. Incorrect approach is analysis. An approach that solely relies on the lowest cost of materials without a thorough risk assessment is professionally unacceptable. This failure constitutes a breach of the pedorthist's duty of care, as it prioritizes economic factors over patient well-being and clinical effectiveness. Such a decision could lead to the use of materials that are not durable, may cause adverse reactions, or are biomechanically unsuitable, potentially exacerbating the patient's condition. This violates the ethical principle of beneficence and non-maleficence. Another incorrect approach is to select materials based solely on personal preference or familiarity, without considering the specific biomechanical demands of the patient's activities or potential material degradation over time. This demonstrates a lack of due diligence and can result in orthotics that fail prematurely or do not provide the intended therapeutic benefit, potentially leading to injury or discomfort. This neglects the requirement for evidence-based practice and patient-centered care. Finally, an approach that ignores patient-reported sensitivities or allergies to specific materials, proceeding with fabrication without adequate investigation or alternative selection, is a significant ethical and regulatory failure. This directly contravenes the principle of informed consent and patient safety, potentially causing severe allergic reactions or other adverse health consequences. It demonstrates a disregard for the patient's autonomy and well-being. Professional reasoning. Professionals should adopt a systematic risk assessment framework. This begins with a thorough clinical evaluation of the patient's condition and functional needs. Next, it involves researching and understanding the properties, limitations, and safety profiles of available orthotic materials, including consulting manufacturer data. This knowledge should then be integrated with the patient's specific circumstances, including lifestyle, activity level, and any known sensitivities. Finally, a collaborative decision-making process with the patient, involving clear communication about material options, their pros and cons, and the rationale for the recommended choice is essential. This ensures that the chosen materials are safe, effective, and meet the patient's needs while adhering to professional standards and regulatory requirements. Question 10. The review process indicates a client with a history of plantar fasciitis and a pronated foot type is insistent on purchasing a highly fashionable, low-profile athletic shoe for daily wear, despite the Pedorthist assessment suggesting this footwear will likely exacerbate their condition due to inadequate arch support and heel cushioning. The Pedorthist has identified several alternative footwear options that offer superior support and cushioning, which would be more appropriate for managing the client's plantar fasciitis. Option A. Fit the client with the requested fashionable, low-profile athletic shoe, as the client is the ultimate decision-maker regarding their footwear purchases, and document the client's insistence. Option B. Firmly refuse to fit the client with the requested shoe, stating it is against professional guidelines, and insist they choose from the recommended supportive options. Option C. Recommend a generic over-the-counter arch support to be inserted into the client's preferred shoe, without further discussion of the shoe's inherent limitations. Option D. Explain to the client the risks associated with their preferred footwear choice, detailing how it may aggravate their plantar fasciitis, and present the alternative, supportive footwear options, collaboratively discussing the pros and cons of each to reach an informed decision together. The correct answer is D. Explain to the client the risks associated with their preferred footwear choice, detailing how it may aggravate their plantar fasciitis, and present the alternative, supportive footwear options, collaboratively discussing the pros and cons of each to reach an informed decision together. Explanation. This scenario presents a professional challenge because it involves a conflict between a client's perceived needs and the Pedorthist's professional judgment based on established footwear fitting principles and the client's underlying medical condition. The Pedorthist must balance patient autonomy and satisfaction with their ethical and professional responsibility to provide safe and effective care. The client's insistence on a specific shoe style, despite evidence suggesting it may exacerbate their condition, requires careful navigation to avoid compromising the client's foot health or the Pedorthist's professional integrity. The correct approach represents best professional practice because it prioritizes the client's long-term health and well-being, aligning with the core principles of Pedorthic care. This involves a thorough assessment, clear communication of findings and recommendations, and collaborative decision-making with the client. By explaining the rationale behind the recommended footwear and the potential risks of the client's preferred choice, the Pedorthist upholds their duty of care and adheres to ethical guidelines that mandate providing evidence-based recommendations. This approach fosters trust and empowers the client to make informed decisions, even if those decisions differ from the Pedorthist's initial recommendation. An incorrect approach that involves overriding the client's stated preference without adequate explanation or exploration of alternatives would be professionally unacceptable. This could be seen as paternalistic and may lead to client dissatisfaction and noncompliance, potentially undermining the therapeutic goals. Furthermore, if the Pedorthist proceeds with fitting footwear that is clearly contraindicated for the client's condition, they risk causing harm, which is a direct violation of their professional responsibility and could have regulatory implications. Another incorrect approach would be to simply acquiesce to the client's demand for the specific shoe style without addressing the underlying concerns or offering suitable alternatives. This demonstrates a lack of professional judgment and a failure to apply established footwear fitting principles. It prioritizes immediate client satisfaction over long-term health outcomes and could be interpreted as a dereliction of duty, potentially leading to negative consequences for the client's foot health and the Pedorthist's professional standing. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Thoroughly evaluate the client's foot condition, biomechanics, lifestyle, and specific needs. 2. Evidence-based recommendation. Formulate recommendations based on established Pedorthic principles and current best practices. 3. Clear communication. Explain the assessment findings, the rationale for recommendations, and the potential risks and benefits of different footwear options in clear, understandable language. 4. Collaborative decision-making. Engage the client in a discussion, addressing their concerns and preferences, and working towards a mutually agreeable solution that prioritizes their health. 5. Documentation. Meticulously document the assessment, recommendations, client discussions, and the final decision. Question 11. The analysis reveals a patient presenting with significant pronation and a history of plantar fasciitis, who is also an avid runner participating in marathons. The Pedorthist is considering several orthotic design principles, which approach best aligns with the principles of orthotic design for this specific patient profile, considering the need for both support and shock absorption during high-impact activity. Option A. Select a flexible, low-density foam orthotic that offers significant cushioning but minimal pronation control, relying on the patient's intrinsic foot strength to manage stability. Option B. Focus on a semi-rigid orthotic with a contoured arch support designed to control pronation, incorporating a shock-absorbing top cover and a heel cup to manage impact forces during running. Option C. Design a custom orthotic with a very aggressive heel bevel and minimal arch contour, emphasizing flexibility throughout the device to allow for natural foot movement and adaptation to terrain. Option D. Prioritize a rigid, high-density material to provide maximum arch support and control pronation, with minimal consideration for cushioning, assuming the runner's conditioning will compensate for shock absorption. Correct answer is D. Prioritize a rigid, high-density material to provide maximum arch support and control pronation, with minimal consideration for cushioning, assuming the runner's conditioning will compensate for shock absorption. Explanation. The analysis reveals a common yet complex challenge in orthotic design, balancing patient-specific biomechanical needs with the practical limitations of material selection and fabrication. This scenario is professionally challenging because a pedorthist must not only understand the theoretical principles of orthotic design, but also apply them effectively in a real-world context where individual patient anatomy, activity levels, and the desired functional outcome are paramount. The decision-making process requires a deep understanding of the Canadian Certified Pedorthist CPED-C Code of Ethics and Standards of Practice, which emphasize patient-centered care, professional competence, and the responsible use of resources. The correct approach represents best professional practice because it prioritizes a thorough biomechanical assessment and a clear understanding of the patient's functional goals before committing to a specific design or material. This aligns with the CPED-C Standards of Practice, which mandate a comprehensive evaluation and the development of a treatment plan tailored to the individual. By considering the interplay between the patient's pathology, activity demands, and the orthotic's intended function, the pedorthist ensures the device will be effective, comfortable, and durable, thereby promoting optimal patient outcomes and upholding the profession's commitment to patient well-being. This patient-first methodology is ethically sound and professionally responsible. An incorrect approach that focuses solely on the most advanced or aesthetically pleasing materials without a corresponding biomechanical justification fails to meet the patient's needs. This could lead to an ineffective or even detrimental orthotic, violating the ethical obligation to provide competent and appropriate care. Such an approach might also represent a failure to adhere to the CPED-C Standards of Practice regarding the selection of appropriate materials and techniques based on clinical assessment. Another incorrect approach that prioritizes ease of fabrication or cost-effectiveness over the patient's specific biomechanical requirements is also professionally unacceptable. While efficiency and resource management are important, they must never supersede the primary duty to provide the best possible care for the patient. This could be seen as a breach of the CPED-C Code of Ethics, which requires pedorthists to act in the best interest of their patients. A third incorrect approach that relies on generic design templates without adequate consideration for individual patient variations ignores the fundamental principles of personalized orthotic intervention. This can result in a device that does not address the underlying biomechanical issues, leading to patient dissatisfaction and a failure to achieve the desired therapeutic goals. This demonstrates a lack of clinical judgment and a departure from the professional standard of care expected of a CPED-C. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a comprehensive biomechanical assessment, including gait analysis and palpation. 2. Clearly define the patient's functional goals and activity demands. 3. Consider the available materials and fabrication techniques in relation to the biomechanical requirements and functional goals. 4. Select the most appropriate design and materials that offer the best chance of achieving the desired outcome while ensuring patient comfort and safety. 5. Document the assessment, rationale for design choices, and patient education thoroughly. This iterative process ensures that the orthotic intervention is evidence-based, patient-centered, and aligned with professional standards. Question 12. The control framework reveals a patient presenting with a noticeable supination during the stance phase of gait and a palpable bony prominence on the medial aspect of the navicular bone, which appears enlarged and tender. The patient reports intermittent pain localized to this area, particularly after prolonged weight-bearing. Considering the bone structure and function of the foot and ankle, which of the following approaches best reflects the Canadian Certified Pedorthist C. Ped C. as professional responsibility and scope of practice? Option A. Immediately fabricate custom orthotics designed to control pronation and provide arch support, assuming the supination is the primary issue causing the pain and the bony prominence is a secondary adaptation. Option B. Conduct a thorough biomechanical assessment, including gait analysis and palpation, to determine if the bony prominence and supination are contributing to functional limitations that can be addressed with custom orthotic intervention, while being prepared to refer to a physician if a primary bone pathology is suspected. Option C. Focus solely on the supination observed during gait and prescribe a rigid orthotic to force the foot into a pronated position, disregarding the palpable bony prominence. Option D. Advise the patient that the bony prominence is likely a benign exostosis and proceed with recommending over-the-counter arch supports to alleviate the supination. The correct answer is B. Conduct a thorough biomechanical assessment, including gait analysis and palpation, to determine if the bony prominence and supination are contributing to functional limitations that can be addressed with custom orthotic intervention, while being prepared to refer to a physician if a primary bone pathology is suspected. Explanation. Scenario analysis. This scenario presents a professional challenge for a Canadian Certified Pedorthist C. Ped C, as it requires them to differentiate between a structural anomaly that falls within the scope of pedorthic intervention and one that necessitates referral to a medical specialist. Misinterpreting the underlying cause of a patient's foot pain and altered gait can lead to inappropriate treatment, potentially exacerbating the condition, delaying necessary medical care, and violating professional standards of practice. The Ped C must exercise careful judgment, drawing upon their knowledge of bone structure and function, to accurately assess the situation and determine the most appropriate course of action, adhering strictly to the regulatory framework governing their practice in Canada. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the patient's reported symptoms, observed gait deviations, and palpation of bony landmarks with an understanding of normal foot and ankle biomechanics. This approach prioritizes identifying whether the observed structural changes are primary bone pathologies or secondary adaptations to underlying biomechanical dysfunction. If the assessment suggests a primary bone issue, such as a fracture, significant degenerative joint disease, or a congenital malformation that impacts weight-bearing or joint stability beyond the scope of orthotic management, the Ped C must refer the patient to a physician or other regulated healthcare professional for further diagnosis and management. This aligns with the ethical and regulatory obligation to practice within one's scope of competence and to ensure patient safety by facilitating access to appropriate medical care when required. The Pedorthic Association of Canada's PAC Standards of Practice and Code of Ethics would guide this decision-making process, emphasizing patient well-being and professional responsibility. Incorrect approaches analysis. An incorrect approach would be to immediately proceed with fabricating custom orthotics solely based on observed gait deviations, without thoroughly investigating the underlying cause of the structural changes. This fails to acknowledge that orthotics are designed to address biomechanical dysfunction, not to treat primary bone pathologies. For instance, attempting to correct a significant varus deformity caused by a malunited tibia fracture with orthotics alone would be inappropriate and potentially harmful. Another incorrect approach would be to dismiss the patient's symptoms as solely soft tissue related and overlook subtle but significant bony abnormalities that might be contributing to the pain and altered function. This demonstrates a lack of thorough assessment and a failure to consider the interconnectedness of the musculoskeletal system. Furthermore, providing orthotic recommendations without considering the potential for underlying systemic conditions that might affect bone health, e.g., osteoporosis, inflammatory arthritis, would also be a failure to meet professional standards. Professional reasoning. When faced with a patient presenting with foot and ankle pain and altered gait, a Ped C should employ a systematic decision-making process. This begins with a detailed patient history, followed by a thorough physical examination including observation of posture and gait, palpation of bony and soft tissue structures, range of motion testing, and functional assessments. The CPED-C must then critically analyze these findings in the context of their knowledge of foot and ankle anatomy, biomechanics, and common pathologies. If the assessment reveals signs or symptoms suggestive of a condition beyond the scope of pedorthic practice, such as acute injury, significant deformity requiring surgical correction, or systemic disease, the professional obligation is to refer the patient to an appropriate medical practitioner. If the findings indicate biomechanical dysfunction that can be addressed with orthotic intervention, the CPED-C can then proceed with the design and fabrication of appropriate devices, ensuring ongoing patient monitoring and reassessment. This iterative process ensures that patient care is safe, effective, and aligned with regulatory and ethical expectations. Question 13. Risk assessment procedures indicate a patient presence with chronic plantar fasciitis and suspected midfoot instability during ambulation. The pedorthist needs to determine the most effective gait analysis technique to inform orthotic design. Which approach would best capture the dynamic forces and kinematic deviations contributing to the patient's symptoms? Option A. Utilizing a single, novel gait analysis method that has not undergone rigorous validation for clinical application in pedorthics. Option B. Relying solely on the patient's subjective description of pain and discomfort during walking, without objective biomechanical measurements. Option C. Performing a static foot posture assessment, measuring arch height and pronation while the patient is standing, and assuming these findings directly translate to dynamic gait issues. Option D. A combination of observational gait analysis, force plate analysis, and 3D motion capture to quantify ground reaction forces and joint kinematics during the gait cycle. The correct answer is D. A combination of observational gait analysis, force plate analysis, and 3D motion capture to quantify ground reaction forces and joint kinematics during the gait cycle. Explanation. Scenario analysis. This scenario presents a professional challenge because the pedorthist must select the most appropriate gait analysis technique for a patient presenting with complex biomechanical issues. The challenge lies in understanding the nuances of each technique and how they relate to the specific diagnostic needs of the patient, ensuring the chosen method will yield actionable data for effective orthotic intervention. This requires a deep understanding of pedorthic principles and the limitations of various analytical tools, all within the scope of practice defined by the Canadian Certified Pedorthist CPED-C regulatory framework. Correct approach analysis. The correct approach involves utilizing a combination of observational gait analysis and instrumented gait analysis, specifically leveraging force plates and motion capture. This represents best professional practice because it adheres to the CPED-C mandate for evidence-based practice and patient-centered care. Observational analysis provides a foundational understanding of gross motor patterns, while instrumented analysis offers objective, quantitative data on kinetics and kinematics. This comprehensive approach allows for a more accurate diagnosis of underlying biomechanical dysfunctions, leading to the design of more precise and effective orthotic devices. The regulatory framework implicitly supports the use of advanced diagnostic tools when they enhance patient outcomes and are within the pedorthist's scope of practice. Incorrect approach is analysis. An approach solely relying on subjective patient reports without objective biomechanical assessment is professionally unacceptable. This fails to meet the CPED-C standard for thorough patient evaluation and can lead to misdiagnosis and inappropriate treatment, potentially violating ethical obligations to provide competent care. An approach focusing exclusively on static foot posture assessment without dynamic gait analysis is also professionally deficient. While static assessment provides valuable information, it does not capture the functional changes that occur during the gait cycle. This omission can lead to orthotic interventions that are ineffective during ambulation, contravening the principle of providing care that addresses the patient's functional needs. An approach that prioritizes a single, non-validated gait analysis technique without considering the patient's specific presentation is also problematic. The CPED-C framework emphasizes the use of validated methods. Relying on an unproven technique or one that is not suited to the patient's condition could lead to inaccurate data and suboptimal orthotic design, potentially falling short of the expected standard of care. Professional reasoning. Professionals should approach gait analysis by first conducting a thorough subjective and objective examination, including static assessment. Based on the patient's reported symptoms and initial findings, the Pedorthist should then determine which dynamic gait analysis techniques will best elucidate the underlying biomechanical issues. This involves considering the patient's functional goals, the complexity of their presentation, and the availability of validated analytical tools. The decision-making process should be iterative, with findings from one assessment informing the next, ultimately leading to a data-driven, orthotic prescription. Question 14. During the evaluation of a patient presenting with significant pronation and a history of plantar fasciitis, the Pedorthist is preparing to take a non-weight-bearing cast of the foot. The patient expresses some apprehension about the process due to a previous uncomfortable experience. Which of the following casting and molding techniques best reflects a patient-centered and technically sound approach within the Canadian Certified Pedorthist CertMedbry regulatory framework? Option A. Utilize a pre-existing generic foot mold that closely approximates the patient's foot shape, skipping the individual casting process to save time. Option B. Gently position the patient's foot and ankle into a neutral, corrected position, ensuring the subtalar joint is reduced, while continuously communicating with the patient about their comfort level and making minor adjustments as needed to maintain the corrected alignment. Option C. Firmly manipulate the foot and ankle into the desired corrected position, applying sustained pressure to ensure the plaster bandage conforms tightly to the foot's contours, regardless of the patient's verbal cues of discomfort. Option D. Proceed with the casting without detailed explanation of the steps, assuming the patient understands the procedure from their previous experience, and focus solely on achieving a static, corrected position. The correct answer is B. Gently position the patient's foot and ankle into a neutral, corrected position, ensuring the subtalar joint is reduced, while continuously communicating with the patient about their comfort level and making minor adjustments as needed to maintain the corrected alignment. Explanation. This scenario presents a professional challenge due to the inherent variability in patient anatomy and the potential for subtle deviations to significantly impact the effectiveness and comfort of a custom-molded orthotic device. The Pedorthist must balance the need for accurate impression taking with the patient's comfort and tolerance during the casting process. Adherence to established pedorthic principles and guidelines, as mandated by the Canadian Certified Pedorthist CertMedbry regulatory framework, is paramount to ensure patient safety and optimal outcomes. The correct approach emphasizes a thorough pre-casting assessment and a patient-centered technique that prioritizes accurate anatomical capture while minimizing discomfort. This aligns with the CertMedbry mandate to provide competent and ethical care, which includes utilizing appropriate techniques for impression taking to create effective orthotic devices. The regulatory framework implicitly requires that casting methods be both technically sound and respectful of patient well-being, ensuring the final product meets the patient's specific biomechanical needs without causing undue distress. An incorrect approach that involves aggressive manipulation of the foot and ankle to achieve a specific position, without adequate patient communication or consideration for their pain tolerance, represents a failure to adhere to ethical practice and potentially violates the CertMedbry standard of care. Such an approach could lead to inaccurate casting, patient injury, and a compromised orthotic device. Another incorrect approach, such as relying solely on a pre-existing generic mold without a current, individualized casting, disregards the fundamental principle of personalized orthotic fabrication and fails to account for any changes in the patient's condition or biomechanics, thus not meeting the standard of care expected of a CertMedbry. Finally, an approach that neglects to document the casting process and any patient feedback during the procedure is a failure in professional record-keeping and communication, hindering future care and accountability. The professional decision-making process for similar situations should involve a systematic approach. First, conducting a comprehensive biomechanical assessment to understand the patient's condition and goals. Second, selecting the most appropriate casting technique based on the assessment and patient factors. Third, clearly communicating the procedure to the patient, explaining what to expect and encouraging feedback. Fourth, executing the casting with precision and sensitivity to patient comfort. And fifth, thoroughly documenting the process and findings. Question 15. The evaluation methodology shows a patient presenting with progressive numbness and tingling in both feet, accompanied by a noticeable change in gait characterized by a wider base of support and reduced foot clearance. The patient reports occasional sharp, burning sensations, particularly at night. The Pedorthist observes areas of dry, fissured skin on the heels and metatarsal heads, with no overt signs of infection. Considering the Canadian Certified Pedorthist C. Ped C. Scope of Practice and Ethical Guidelines, which of the following assessment and intervention strategies best addresses this complex presentation? Option A. Prescribe standard diabetic foot inserts to address the dry skin and recommend a wider-soled shoe to accommodate the altered gait. Option B. Advise the patient to consult a physician for a definitive diagnosis of the neuropathy and await their recommendations before proceeding with any pedorthic intervention. Option C. Focus solely on managing the dry skin with emollients and recommend a simple arch support to improve foot posture. Option D. Conduct a detailed sensory and motor neurological assessment of the lower limbs, analyze gait biomechanics for compensatory strategies, and design custom orthotics to offload high-pressure areas and provide appropriate support, while educating the patient on self-care and monitoring. The correct answer is D. Conduct a detailed sensory and motor neurological assessment of the lower limbs, analyze gait biomechanics for compensatory strategies, and design custom orthotics to offload high-pressure areas and provide appropriate support, while educating the patient on self-care and monitoring. Explanation. The evaluation methodology shows a pedorthist encountering a patient with a complex lower limb neuropathy, presenting a professionally challenging scenario due to the nuanced interplay between the neurological condition, biomechanical compensations, and the need for effective orthotic intervention. Careful judgment is required to differentiate between primary neuropathic symptoms and secondary musculoskeletal issues, ensuring the orthotic plan addresses the root cause while mitigating risks of exacerbation or new complications. The correct approach represents best professional practice by prioritizing a comprehensive, evidence-informed assessment that integrates patient history, physical examination, and functional evaluation. This aligns with the Canadian Certified Pedorthist C. Ped C. Scope of Practice, which mandates a thorough understanding of lower limb anatomy, biomechanics, and pathology, including neurological conditions. The focus on identifying specific sensory and motor deficits, assessing gait patterns for compensatory strategies, and considering the patient's overall health status ensures a personalized and safe intervention. This approach upholds the ethical obligation to provide competent care and to act in the best interest of the patient, as guided by the College of Pedorthics of Canada's Standards of Practice and Code of Ethics. An incorrect approach that relies solely on subjective patient reports without objective physical assessment would be professionally unacceptable. This fails to meet the standard of care expected of a C. Ped C, potentially leading to misdiagnosis or inappropriate orthotic prescription. Ethically, it breaches the duty of due diligence and could result in patient harm. Another incorrect approach that focuses only on superficial symptoms, such as calluses or skin breakdown, without investigating the underlying neuropathic cause, is also professionally deficient. This reactive approach neglects the proactive and preventative responsibilities of a pedorthist and may not address the progressive nature of neuropathies. It also fails to adhere to the C. Ped C requirement to understand the etiology of the patient's condition. A third incorrect approach that involves prescribing a generic, off-the-shelf device without considering the specific biomechanical and neurological needs of the individual would be ethically unsound and professionally incompetent. This demonstrates a lack of individualized care and a failure to apply specialized knowledge, contravening the principles of evidence-based practice and patient-centered care. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly gather patient history, including onset, progression, and specific symptoms of the neuropathy. 2. Conduct a comprehensive physical examination, including neurological assessments, e.g., sensory testing, reflex testing, motor strength, and biomechanical evaluations of the foot and ankle. 3. Analyze gait and functional mobility to identify compensatory patterns and potential risks. 4. Integrate findings to develop a differential diagnosis and a targeted orthotic plan that addresses the identified deficits and risks. 5. Regularly reassess the patient's response to intervention and adjust the plan as needed. This iterative process ensures that the pedorthist remains responsive to the evolving needs of the patient and adheres to the highest standards of professional practice. Question 16. The efficiency study reveals that a patient presents with moderate pronation and a history of plantar fasciitis. They express a strong preference for a particular brand of athletic shoe known for its minimalist design and flexibility, stating it feels most comfortable during their daily activities. As a Canadian certified Pedorthist Ped-C, what is the most appropriate initial footwear consideration? Option A. Recommend footwear that provides adequate arch support and heel cushioning, explaining to the patient how these features can help manage their pronation and plantar fasciitis, while exploring options within the preferred brand or similar supportive designs. Option B. Suggest the patient try various brands of athletic shoes without specific recommendations, allowing them to self-select based on their subjective comfort. Option C. Advise the patient that their preference for minimalist footwear is incompatible with their condition, and suggest they explore entirely different categories of shoes, such as orthopedic boots. Option D. Immediately prescribe the specific minimalist athletic shoe the patient desires, as patient comfort and preference are paramount in ensuring compliance. The correct answer is A. Recommend footwear that provides adequate arch support and heel cushioning, explaining to the patient how these features can help manage their pronation and plantar fasciitis, while exploring options within the preferred brand or similar supportive designs. Explanation. This scenario is professionally challenging because it requires the pedorthist to balance the patient's immediate comfort and perceived needs with the long-term health and functional outcomes dictated by the regulatory framework and best practices for pedorthic care. The pedorthist must exercise careful judgment to ensure that any footwear recommendation is not only acceptable to the patient, but also aligns with their professional responsibilities and the standards of practice. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's biomechanics, pathology, and functional goals before making any footwear recommendations. This aligns with the Canadian Certified Pedorthist Ped-C regulatory framework, which mandates a thorough patient evaluation to ensure that interventions are evidence-based and tailored to individual needs. By considering the patient's specific foot structure, gait, and any underlying conditions, the pedorthist can select footwear that provides appropriate support, alignment, and shock absorption, thereby promoting optimal foot health and function. This approach upholds the ethical obligation to act in the patient's best interest and to provide competent, evidence-informed care. An incorrect approach that involves immediately accommodating the patient's request for a specific type of shoe without a proper assessment is professionally unacceptable. This fails to meet the regulatory requirement for a comprehensive patient evaluation and could lead to inappropriate footwear that exacerbates existing conditions or creates new problems. Ethically, it breaches the duty of care by not providing the most beneficial and safe intervention. Another incorrect approach, such as recommending footwear based solely on aesthetic appeal or brand popularity, disregards the fundamental principles of pedorthic practice. This is a direct violation of the regulatory framework's emphasis on functional outcomes and biomechanical considerations. It prioritizes superficial factors over the patient's health and well-being, constituting a failure in professional judgment and ethical conduct. Finally, an approach that involves deferring the decision entirely to the patient without offering professional guidance or education is also unacceptable. While patient autonomy is important, the pedorthist has a professional responsibility to educate the patient about the implications of different footwear choices and to guide them towards the most appropriate options based on their clinical presentation. Failing to do so abrogates the pedorthist's expertise and could lead to suboptimal outcomes. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough biomechanical and clinical assessment of the patient's feet and lower limbs. 2. Identify and diagnose any relevant pathologies or functional limitations. 3. Discuss the patient's goals, lifestyle, and preferences. 4. Educate the patient on the principles of appropriate footwear for their specific needs. 5. Recommend footwear options that are biomechanically sound, address the identified issues, and align with the patient's functional goals and preferences. 6. Document the assessment, recommendations, and patient education thoroughly. Question 17. Regulatory review indicates that when designing custom orthotics for a patient presenting with complex biomechanical deformities and a history of material sensitivities, a pedorthist must select the most appropriate fabrication approach. Which of the following approaches best aligns with the Canadian Certified Pedorthist (PED-C) standards of practice and ethical guidelines? Option A. Utilizing a standard, off-the-shelf orthotic shell and modifying it extensively with padding and strapping to accommodate the patient's unique needs and sensitivities. Option B. Prioritizing the use of the least expensive, readily available materials to manage costs, even if they are not specifically tested for hypoallergenic properties, and fabricating the orthotic based on a general impression of the foot. Option C. Employing a fully custom fabrication process using CAD/CAM technology to create a precise mold based on detailed anatomical scans, followed by the selection of hypoallergenic, biocompatible materials specifically chosen to mitigate the patient's known sensitivities. Option D. Recommending a pre-designed, widely available orthotic model that has shown general success in similar cases, with minimal adjustments made during the fitting process. The correct answer is A. Utilizing a standard, off-the-shelf orthotic shell and modifying it extensively with padding and strapping to accommodate the patient's unique needs and sensitivities. Explanation: this scenario presents a professional challenge due to the inherent variability in patient anatomy and the diverse range of materials and fabrication techniques available for orthotic design. A pedorthist must exercise careful judgment to select the most appropriate approach that balances biomechanical effectiveness, patient comfort, durability, and cost, all while adhering to professional standards and regulatory guidelines. The correct approach represents best professional practice because it prioritizes a systematic, evidence-informed, and patient-centered methodology. This involves a thorough biomechanical assessment, consideration of the patient's specific condition and lifestyle, and the selection of materials and fabrication methods that are proven to be effective and safe. Adherence to the standards of practice and ethical guidelines set forth by the Canadian Certified Pedorthist (PED-C) regulatory body ensures that the pedorthist is acting in the best interest of the patient and maintaining professional integrity. This includes proper documentation of the assessment, design rationale, and fabrication process, which is crucial for accountability and continuity of care. Incorrect approaches fail to meet professional standards and may lead to suboptimal patient outcomes or ethical breaches. One incorrect approach might involve relying solely on a pre-existing, generic design without adequate customization, which disregards the unique biomechanical needs of the individual patient. This could be considered a failure to provide competent care as mandated by professional practice standards. Another incorrect approach could be the selection of materials based purely on cost or ease of fabrication, without considering their suitability for the intended application or potential for adverse reactions, which violates the ethical obligation to prioritize patient well-being and safety. Furthermore, neglecting to document the design rationale or fabrication process could be a violation of record-keeping requirements, hindering accountability and potentially impacting future treatment. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive patient assessment. Conduct a thorough biomechanical evaluation, including gait analysis, palpation, range of motion assessment, and understanding the patient's functional goals and limitations. 2. Differential diagnosis and problem identification. Clearly identify the biomechanical issues that the orthotic intervention aims to address. 3. Evidence-informed design rationale. Based on the assessment and identified problems, develop a clear rationale for the proposed orthotic design, considering established biomechanical principles and available evidence. 4. Material and fabrication method selection. Choose materials and fabrication techniques that are appropriate for the specific orthotic design, patient needs, and intended use, prioritizing safety, efficacy, and durability. 5. Patient education and collaboration. Discuss the proposed design, materials, and expected outcomes with the patient, ensuring their understanding and obtaining informed consent. 6. Fabrication and fitting. Execute the fabrication process with precision and conduct a thorough fitting to ensure proper alignment, comfort, and function. 7. Follow-up and evaluation. Schedule follow-up appointments to assess the effectiveness of the orthotic, make necessary adjustments, and ensure patient satisfaction. 8. Documentation. Maintain detailed and accurate records of all aspects of the assessment, design, fabrication, fitting, and follow-up. Question 18. System analysis indicates a Canadian certified Pedorthist C. Ped C is consulting with a patient who has a history of plantar fasciitis and mild pronation. The patient expresses a strong desire to purchase a specific brand of fashion sneakers known for their trendy appearance, but which the Pedorthist recognizes as having a very flexible sole, a low heel-to-toe drop, and a narrow toe box, features that are biomechanically suboptimal for the patient's condition. The patient states, "I really like how these look and my friends all wear them. I just need you to tell me if they are okay." Which of the following represents the most ethically and professionally sound approach for the C. Ped C in this situation, considering the anatomy of footwear and the patient's specific needs? Option A. Immediately approve the fashion sneakers, as the patient's preference and social influence are primary considerations, and focus on recommending an over-the-counter arch support to be inserted into the sneakers to compensate for any perceived deficiencies. Option B. Conduct a thorough biomechanical assessment of the patient. Explain how the specific features of the requested fashion sneakers, e.g., sole flexibility, heel-to-toe drop, toe box volume, may negatively impact their plantar fasciitis and pronation, and collaboratively explore alternative footwear options that offer appropriate support and cushioning while attempting to meet some of the patient's aesthetic preferences. Option C. Recommend a custom orthotic device that can be fabricated to fit within the fashion sneakers, assuring the patient that the custom device will correct any biomechanical issues regardless of the shoe's inherent anatomical limitations. Option D. Advise the patient that the requested fashion sneakers are entirely unsuitable due to their poor anatomical design for foot health and refuse to provide any further recommendation, suggesting they seek advice elsewhere if they insist on wearing such footwear. The correct answer is B. Conduct a thorough biomechanical assessment of the patient. Explain how the specific features of the requested fashion sneakers, e.g., sole flexibility, heel-to-toe drop, toe box volume, may negatively impact their plantar fasciitis and pronation, and collaboratively explore alternative footwear options that offer appropriate support and cushioning while attempting to meet some of the patient's aesthetic preferences. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the C. Ped C to balance a patient's expressed preference with their professional knowledge of footwear anatomy and biomechanics, while also considering the potential for harm. The patient's desire for a specific aesthetic or perceived comfort, driven by external influences, may conflict with the Pedorthist's assessment of what is functionally appropriate and safe for their foot condition. Navigating this requires careful communication, patient education, and an ethical commitment to patient well-being over immediate patient satisfaction if that satisfaction compromises health. Correct approach analysis. The correct approach prioritizes the patient's long-term foot health and functional needs, grounded in the C. Ped C. S expertise in footwear anatomy and biomechanics. This aligns with the ethical obligations of a healthcare professional to act in the best interest of the patient, as outlined by the College of Pedorthics of Canada's Code of Ethics and Practice Standards. Specifically, it upholds the principle of beneficence, acting for the patient's good, and non-maleficence, avoiding harm. A thorough assessment of the patient's foot condition, gait, and activity level, combined with an understanding of how different footwear components, e.g., sole flexibility, heel height, arch support, toe box volume, impact these factors is paramount. Recommending footwear that addresses the underlying biomechanical issues, even if it differs from the patient's initial preference, demonstrates professional integrity and a commitment to evidence-based practice. Incorrect approaches analysis. One incorrect approach involves immediately acquiescing to the patient's request for the specific fashion shoe without a comprehensive assessment or discussion of its suitability. This fails to uphold the professional duty to assess and recommend appropriate footwear based on anatomical and biomechanical principles. It risks causing harm by potentially exacerbating the patient's existing condition or leading to new problems due to inadequate support or inappropriate shoe construction. This approach prioritizes patient preference over professional judgment and patient welfare, violating ethical principles. Another incorrect approach is to dismiss the patient's preference outright, without attempting to understand the underlying reasons or explore potential compromises. A professional judgment is key. A lack of empathy or collaborative problem-solving can damage the patient-pedorthist relationship and lead to noncompliance. This approach may be perceived as paternalistic and fails to engage the patient in their own care, which is crucial for successful outcomes. It neglects the importance of patient-centered care, which involves understanding the patient's perspective and working towards shared goals. A third incorrect approach is to recommend a generic, off-the-shelf orthotic insert to be placed within the fashion shoe without a thorough analysis of the shoe's internal structure and its ability to accommodate the insert effectively. While inserts can be beneficial, their efficacy is heavily dependent on the footwear they are placed in. A shoe with insufficient depth, poor heel counter stability, or an inappropriate sole design may not properly support or integrate with an insert, rendering it ineffective or even detrimental. This approach bypasses a critical aspect of footwear anatomy, the internal environment, and its interaction with supportive devices. Professional reasoning. Professionals should approach such situations by first actively listening to and acknowledging the patient's preferences and concerns. This is followed by a comprehensive biomechanical assessment of the patient's feet and gait. The Pedorthist then educates the patient about their findings, explaining how specific features of footwear anatomy, e.g., sole rigidity, heel-to-toe drop, toe box shape, cushioning, relate to their condition and functional needs. The professional should then collaboratively explore footwear options, explaining the pros and cons of various styles and materials, and ideally presenting alternatives that meet both functional requirements and some of the patient's aesthetic desires. The ultimate decision should be a shared one, with the Pedorthist providing clear, evidence-based recommendations and the patient making an informed choice, understanding the potential consequences. Question 19. The audit findings indicate a pattern of Pedorthists recommending off-the-shelf orthotic devices for patients presenting with Achilles tendinopathy without a thorough biomechanical assessment or consideration of specific rehabilitation protocols. Which of the following approaches best reflects the required standard of care for managing tendon injuries in accordance with the Canadian Certified Pedorthist CertMedbry regulatory framework? Option A. Refer the patient immediately to a physician for surgical intervention, bypassing any conservative management strategies that could be provided by a Pedorthist. Option B. Prescribe a generic over-the-counter orthotic device that offers general arch support, assuming it will alleviate symptoms for most cases of Achilles tendinopathy. Option C. Advise the patient to rest completely and avoid all weight-bearing activities until the pain subsides, without offering any specific interventions or guidance. Option D. Conduct a comprehensive biomechanical assessment to identify contributing factors, develop a personalized orthotic prescription if indicated, and educate the patient on activity modification and a progressive rehabilitation program. The correct answer is D. Conduct a comprehensive biomechanical assessment to identify contributing factors, develop a personalized orthotic prescription if indicated, and educate the patient on activity modification and a progressive rehabilitation program. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Pedorthist to balance immediate patient relief with long-term functional recovery and adherence to professional standards. Mismanagement of tendon injuries can lead to chronic pain, reduced mobility, and potential re-injury, impacting the patient's quality of life and the Pedorthist's professional reputation. The audit findings highlight a need for rigorous adherence to evidence-based practice and regulatory guidelines. Correct approach analysis. The correct approach involves a comprehensive assessment, including a thorough biomechanical evaluation, to identify the underlying causes of the tendon injury. This is followed by the development of a personalized treatment plan that incorporates appropriate orthotic intervention, patient education on activity modification and rehabilitation exercises, and clear communication regarding prognosis and follow-up. This aligns with the Canadian Certified Pedorthist CertMedbry's scope of practice, which emphasizes a holistic approach to foot and lower limb health, prioritizing patient well-being and evidence-based care. Adherence to the College of Pedorthics of Canada's standards of practice and code of ethics is paramount, ensuring that all interventions are safe, effective, and ethically sound. Incorrect approaches analysis. One incorrect approach would be to solely focus on symptomatic relief without addressing the root biomechanical contributors to the tendon injury. This fails to meet the professional obligation to provide comprehensive care and may lead to recurrence or worsening of the condition, violating the principle of patient welfare. Another incorrect approach would be to recommend aggressive interventions without adequate patient education or consideration of the patient's activity level and goals. This could result in patient noncompliance, frustration, and potential harm, contravening the ethical duty to inform and empower patients. A third incorrect approach would be to deviate from established clinical guidelines or evidence-based practices without a clear, documented rationale. This could be seen as unprofessional conduct and a failure to maintain professional competence, potentially leading to disciplinary action by the College of Pedorthists of Canada. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough patient assessment, including history, physical examination, and biomechanical analysis. This is followed by differential diagnosis, consideration of treatment options based on current evidence and patient-specific factors, and the development of a collaborative treatment plan. Regular reassessment and communication are crucial to monitor progress and adjust the plan as needed. This structured approach ensures that all interventions are justified, patient-centered, and aligned with professional standards and regulatory requirements. Question 20. Implementation of a footwear recommendation for a patient who engages in both moderate-intensity walking on varied terrain and occasional light recreational sports requires a nuanced understanding of different shoe constructions. Considering the patient's history of mild pronation and a preference for comfort, which comparative analysis of footwear types best addresses their needs within the scope of a CPED-C-S practice. Option A. Advising a high-top basketball shoe for its ankle support, prioritizing its perceived protective qualities for sports, without a comparative analysis of its suitability for walking or its impact on the patient's mild pronation during daily activities. Option B. Comparing the stability features of a motion control running shoe designed for overpronation with the cushioning and flexibility of a trail running shoe suitable for uneven surfaces, highlighting how each addresses specific biomechanical demands and activity requirements. Option C. Recommending a casual walking shoe with ample cushioning, emphasizing its aesthetic appeal and comfort for daily wear, without detailed consideration of its suitability for recreational sports or specific pronation control. Option D. Suggesting a minimalist athletic shoe that promotes natural foot movement, focusing on its lightweight design and breathability, while overlooking the patient's pronation and the varied demands of their activities. The correct answer is B. Comparing the stability features of a motion control running shoe designed for overpronation with the cushioning and flexibility of a trail running shoe suitable for uneven surfaces, highlighting how each addresses specific biomechanical demands and activity requirements. Explanation. This scenario presents a common challenge for a Canadian certified pedorthist, CPED-C, where a patient's lifestyle and specific needs require careful consideration of footwear types. The professional must balance the patient's stated preferences with their clinical assessment and the functional requirements of different footwear categories to ensure optimal outcomes and safety. This requires a deep understanding of how various footwear designs interact with biomechanics and the demands of different activities, all within the scope of practice, defined by the College of Pedorthists of Canada. The correct approach involves a comparative analysis of footwear types, directly linking their design features to the patient's stated activities and potential biomechanical issues. This demonstrates best professional practice by prioritizing patient well-being and functional efficacy. A CPED-C is ethically and regulatorily bound to provide evidence-based recommendations that are tailored to the individual. This approach ensures that the chosen footwear will support the patient's goals, mitigate risks, and align with the principles of biomechanical support and injury prevention, as expected by the college. Incorrect approaches fail to adequately consider the interplay between footwear design, activity demands, and individual biomechanics. Recommending footwear based solely on aesthetics or a superficial understanding of activity type, without a thorough biomechanical assessment and a comparative analysis of suitable footwear categories, represents a failure to meet professional standards. This could lead to inadequate support, increased risk of injury, or exacerbation of existing conditions, thereby contravening the CPED-C-S duty of care and the ethical guidelines set forth by the college. The professional decision-making process for similar situations should involve a systematic evaluation. First, thoroughly assessing the patient's condition, activity level, and goals. Second, understanding the biomechanical implications of their condition and activities. Third, conducting a comparative analysis of relevant footwear types, considering their construction, materials, and intended use. And finally, educating the patient on the rationale behind the recommendation, empowering them to make an informed choice while ensuring the chosen footwear aligns with their clinical needs.